So some of the more serious symptoms related to TBI or PTSD, where there's anger in the family, blaming, inappropriate disciplining of children that occurs, can lead to lots of fractures in the family, both kind of bad feelings between the children and the parents, bad feelings between the parents because of observations of what's going on. And so I think the only way to really focus on that is to be thinking about using family-centered approaches where parents really serve as the leaders of the family, and we work together to develop some common and shared goals and to work together towards those goals. So I think even though in the moment a vet with PTSD or TBI might explode and get angry and yell and scream at kids, that in the if you ask that person, that's not what they want to do. They want to have good relationships with their kids and their spouses. So if those shared goals can be recognized, that's something I think all family members can agree on. And then it becomes really a matter of thinking together and talking and problem solving and figuring out, okay, what are the most likely times that that's going to happen? What are the triggers that dad has that are going to cause more problems for him? How can we limit those? How can we set up the family in a way or the schedule in a way that's less likely to result in that and minimize those kinds of problems? So those are ways that the families can work together successfully. I think the other thing that can happen is to recognize when hotspots are occurring in the family. So it's a certain time of the day. If a parent is on medication that makes him or her sleepy or unavailable during the day, or if they're on pain medications associated with another medical condition that are given a certain time of the day that makes them available, or that when they don't have it, they're really grumpy. We want to know when those times are, because we can then think together with the parents about, well, maybe that's not the best time for dad to be helping, Sarah, the 13-year-old daughter, with her homework. It's a time, maybe that's something that mom needs to do. So co-parenting is something that all families need to figure out. How do parents share the load? How do they work together? And when there's been this impact on one of the members of the family in terms of cognitive functioning, in terms of reactivity, in terms of interpersonal contact, then it means that there needs to be a shift in the way that co-parenting takes place. So need to think together, you used to do this, but now maybe it's better if I do this. Or you're getting less involved in disciplining our 17-year-old son, but I really need for you to be more involved in that because you're the dad and he's going to look at you in a different kind of way. So how can we make that work? So there are some simple and more complicated ways of understanding the family needs, thinking about how they can work together, co-parenting successfully together. And that also means trusting each other. It's a certain amount of trust where it's like, okay, I really shouldn't be doing this anymore. I need to lean on you a little bit to do that. And that requires a certain amount of maturity in the couple to be able to do that.